right, so my name is Bailey of E12 Performance Fitness. We are a sports training facility, athletic training facility, and we enjoy cross training a lot. We use cross training as injury prevention because we also understand that a lot of our athletes are doing what they do all the time. If they're playing basketball, it's a lot of pounding on the hardwood, if it's the grass, a lot of cutting, a lot of stopping, a lot of deceleration. It doesn't matter the sport, you're pretty much doing that all the time. So cross training pretty much keeps us in balance. So with that, we try to incorporate things that are going to keep us in balance. This is pretty hard to use when you are prepping for a game because you only get an hour, 30 minutes, right? So when we're talking about being preventative, we're talking about being proactive as well, right? And with Coach Wally and a lot of us are talking about was more or less knowing thyself, being accountable. I've had the pleasure of being healed and worked on by Dr. O. I tore my meniscus, also Sherman as well. And with my guy D in the back, he was my PT. And going through the prevention process was terrible. I mean, going through the healing process was terrible. I'm the athlete that has the ego. I'm the athlete that you have to save him from himself, right? I like to skip steps. That's just me, right? But I always try to teach, right? Do as I say, not as I do, okay? So with that, right, we are incorporating certain modalities. The first thing that we like to do is try to inhibit these muscles. We try to massage them, we try to relax them, we try to get knots out of adhesion. So the first thing that we do is we drop down on our foam rollers. I like to teach from the core first. I like to also teach the core, the hips versus just the abs, all the sexy parts, right? Most of our dysfunctions are coming from our hips. So we try to work from there first. Okay, so bring it down. My first movement that I like to go into on my first stretch would probably be a glute or a hip flexor stretch type of release. All right, so, oh yeah, we getting on, Khalil? Gotcha. So my favorite group to go to is the glute first, right? Roll the glute. I probably spend, depending on my timing, right? If I'm getting prepped for a game and I know that I had to sneak my foam roller in and this is a team thing and I gotta be off to the side, I'm probably spending anywhere between like 2 minutes, maybe 90 seconds per muscle group. But if I'm by myself, I could probably spend 20 minutes rolling. It's all about warming up and having that nervous system ready to fire. So we have Khalil rolling his glute. This is the part of the warm-up that we don't get to do during our workouts. But he's a killer on the dynamic side. All right, so in a piriformis stretch, pretty much leaning on that muscle group, wherever you feel the stretch is where you want to roll, right? You're spending a little bit of time there. After that, we go straight to our hip flexor. I like to roll out one side so that way I can assess at the end. I'm going to turn my roller to the side. I'm going to lay on my belly, right in our planking position. Yep, bringing it up, right? And I'm rolling from my knee towards my hip. All right, and as I do this, I'm trying to put as much pressure as I can through this roller. This is my massage therapist, and she has to work very fast. She's gonna be mean. She's gonna put a lot of pressure on me, okay? A lot of pressure, right? So once I go from my glute and I go to my hip flexor, if I feel like I need to go hip flexor first, right? Know thyself, know what needs to be touched, right? Then from there, I go to my medius, right? Still working the hips, still working on the core. Because again, a lot of our injuries are coming from our lower body injuries, and sometimes even upper body injuries are coming from hip displacement. Turn on that side. Drop that elbow. Yep. Yes. Yes. You got it. Good job. You got it. Right. So working that glute, working that hip flexor, going to the sides of the hips, right? Working that medius because that's controlling that rotation. We also talked about just those non-contact injuries oftentimes, right? Weak core muscles in the hips can cause injuries down the line. Good, good. Ready to go to the next one? All right, so the next muscle group that I like to hit would be the IT band, and I work from the IT band all the way to the quad. Perfect, right? Rolling through. Normally this muscle hurts when you roll it, right? I love the faces that I get from my clients and the athletes. There's a lot of oohs and ahs, and I let them know that when they stand up and they go through the assessment that they'll feel so much better, and that this is, again, a vital group that you want to make sure that you are attacking. Boom, from there we go to our quads, all right? Get back into our low plank position, okay? Pushing and pulling from the elbows. Sometimes you may help with that toe, going for plantar, dorsal flexion, warming up those movements, okay? Boom, where your hamstrings. So there are like other things that we do on the rollers, like spanning, and it's like once they start getting more comfortable with the rollers, we start teaching them about their zones, part of the muscle group, like the muscle bellies and things of that nature. Because again, like we all know, we've all warmed up, like you know what hurts, you know what needs to be worked on, right? So a part of that is, again, just trying to cut out more time. Like, you know, your game starts at this time and you know the grip warms up and you start prepping for the hour, like, yeah, you need to be doing it 30 minutes before. Or you need to have it close behind the bench, something that's gonna keep you right. Okay, going to the calves now. Going to the calves. We've also seen professional athletes. We've seen it more now than ever. Incorporating rollers, incorporating bands, not going through those normal ranges of motion, right? The common ones. Okay, because each athlete has their own compensations. Each athlete has their own thing that they're working on and dealing with, right? So you see them being more accountable by themselves or with the trainer on the side doing this. Like, what are they doing? Like, running their business, getting ready. Getting ready.
And this additional 10 minutes, oftentimes, it's the athletes that are going to take those extra 10, 15 minutes to get there early, take care of their bodies, provide themselves the relief that they need, listen to their bodies. Those are the athletes that are starting to set themselves apart. Again, we talked about the details, doing an effective dynamic workout, going above and beyond. These are the details that start to matter, and that's the prevention that keeps the athletes on the field, not the clinic.
Yeah. So now, we're attacking the low back area. Science says not to roll the spine, so you just kind of want to catacorner yourself, turn towards that hip side, drive out of those heels. Again, this is your masseuse, okay? You just want to, you don't want to spend too much time doing this because you're getting ready to go into sport, you're getting ready to go into play. So, again, you just want to try to hit those muscle groups as best you can. I'm going up into the upper back and middle back. Yes? Yeah. Okay. Going towards that lat area, trying to release some tension. Rolling up into that trap a little bit. All right, so boom, let's just say I did what I was supposed to do. I always roll out one side and I go through my hop test. My hop test can seem like a little placebo thing, right? But it's good for morale. It's really good for morale. So I'll hop on one side and then I'll hop on the other, and naturally I'll feel lighter on the side that I roll. Once I feel light on that side, it's letting me know go to the other side. So I try not to roll out left leg, right leg, and then hit all the way up. I do one side, test that side. If it feels good, all right, cool. Get down, be quick, knock it out. That makes sense? Yes?
Yeah.
So behind that, okay. Nope, not grabbing that yet. Not grabbing that yet. We go into our movement prep. Okay, so again, it's just my philosophy. It's just my approach. Everybody's different, right? But I like to work from the core out to the extremities. Okay, so I work hips first, right? We all seen the lunge, right? Anytime I'm going for my lunge, this is when I'm assessing myself. It might send me back to the roller if I have time, okay? It might send me to a static stretch. It normally wouldn't do a static stretch before we do something explosive or dynamic, but again, it's knowing thyself. It's telling me what I need to do. I need to prep and be more preventative. So I get into my lunge, I'm sinking down, trying to get good angles in my knees, right? Feeling pressure, feeling the tensions. That feels great. I'm working on keeping the stiff heel in the back, turning the heel out the way that I need to, and then I'm sinking back, leaning back, and I'm going for a hip flexor stretch, right? I'll add some rotation because most of our sports are working in 3 planes of motion, right? Frontal, sagittal, transverse. So use always some type of rotating type of movement. If I know I need to get longer, I might feel some lat stuff, right? I start to reach, and it adds more stretch on my quad, on my hip flex, and things of that nature. If I need to modify it because I can't get to that range of motion, maybe I'm injured, right? I just get into a split stance. Again, looking for that extension of the spine and then just turn it, right? Just trying to find that stretch as soon as possible without hurting myself, right?
And a huge part of dynamic warm-ups is also listening to your body. Each day an athlete's body is going to respond differently depending on how many games they've had in a week, how many workouts they've had in a row. So using this time to also check in. But we've talked about earlier when we talked about hurt and injury, a lot of athletes need to be taught what is good and bad pain, right? So when we're in stretches, when we're in the foam roller, this is the time where athletes, especially young athletes, need to learn what is normal, what is not, what is good pain, what is bad pain. This is a great time for them to check in with their bodies, and then helping them communicate with their coaches and with their therapists and say, today I did this, my hip flexor felt really tight, and then I noticed this in practice. So being able to draw those connections and educate them to listen to their body is also really important.
I work with those athletes, they have egos, they don't want to tell you that they hurt. And it's also, again, coming from the culture that if I tell you that, if they tell me that they hurt, that will translate into them not.
Absolutely. And I use the language of don't let little issues turn into big issues. Yeah. So if you come to me and say, hey, my hip flexor's starting to feel tight, that is a small issue that is very fixable, versus I had a lack of range of motion, I landed weird, it transitioned down to my knee, and now I have an ACL tear. So I always say all the time, don't let little issues become big issues. You're not getting in trouble. Communicate these things. It's important. And as they learn that, it becomes a mental game of them knowing that's a safe space.
Yep. And then the next movement that we go into normally after the hip flexor movement is our glute movement. Then we add some balancing, working on triple extension, right? The ankles, knees, and hips, things of that nature. Again, warming up those muscle groups, priming the nervous system for exactly what they're getting ready to do, okay? So yep, we do our normal glute stretch. Sometimes they add a little bit too much rotation. I like to pull straight up, and then if I do any rotation on my glute stretch, I don't crank it, right? Because that muscle doesn't turn like that. And I had to learn that the hard way, that muscle does not turn like that, right? So what I try to pull the knee up to the shoulder. And normally I get the same amount of stretch that I would get if I was trying to do a stack. All right, and again, I'm just testing more so, not as much as my glute stretch, right, but my balance as I'm doing this. Okay. And again, if I'm falling all over the place, it's going to require me to do more, because I'm going to prime my nervous system. So many of our injuries, even if it is contact, right? Most of it sometimes is not contact, it's happening in unilateral movements. So it's just being conscious of that. All right, so we did our hip flex, we did our glute. So normally from there, go straight into our extremities and hamstrings, hinge movements, right? Understanding that you do want to close the hip, so you get a deeper stretch in the hamstrings, right? Hinging down as much as you can. Working on fast twitch rather than walking, because who knows what type of time that we have, right? It'll pick it up, boom. Just running through it, quick steps. Again, priming the fast twitch, right? Waking up the nervous system and things of that nature. Okay, so directly after that, I like to do double drop squats. I have serious compensations. When I do my drop squats, I don't let my hips touch the ground, and it's also normal too because I'm priming for running, cutting, jumping sports. So I try to make sure I'm working on ankle stiffening movements. So when I drop, I also know if I'm on my toes, my body's going to work the way it's functioning. It's the way it's functioning. My hips are going to open. It's easier for them to get down, right? And again, it's priming me for exactly how I'm going to move, right? So squats are cool, but we're talking dynamic warm-up, right? We're trying to make it as athletic as possible, right? It's priming the nervous system, right? So I have my body with squats there. That feels great. Cool, but you know that you're getting ready to jump.
Yeah, because ultimately sport is dynamic. So sitting on the ground and touching your toes and holding there for 30 seconds is not a dynamic warm-up. That is, yes, a hamstring stretch, but it is not going to be as effective and valuable as walks with quick steps and being able to use and increase our heart rate and get ourselves primed for sport.
Next one, we're going more frontal, right? Going into your running stretch from here. I'm working on my ankle flexibility as well. Right, driving it out. Sometimes I'll turn the toe as well as to get deeper into my calves as well as my hamstrings. And then on the opposite side, I'll take that elbow and I'll just drive it away. Right, stretching the adductor, stretching everything on the inside. Again, keeping me from having these extra butterfly stretches and stuff like that. You try to incorporate as much of other movements as possible, okay? Going right into that. So boom, that's our active. Now it's more dynamic. We try to move through essentially the same ranges of motion that we just went through actively, right? So with our lunge and twist, we try to keep it unilateral. We go straight into our high knees, right? Or explosive-ish line, as you would say, right? And then behind the high knees, we normally do butt kicks, right? I teach butt kicks two different ways. I teach the normal quad stretch, hamstring gets warm way, right? But naturally, because we're going into sport, You want to teach the body to move the way it needs to,
Yeah.
right? So naturally, when you do a butt kick, that's how it starts out. When we're getting ready to spring, I'm trying to bring my knees up, and I'm trying to hit the underside of my butt. My calves are too big, so my heel doesn't touch my butt, all right? But again, I'm priming my nervous system, I'm priming my body. And this is a great time, again, for us as trainers, coaches, to assess our athlete all the time. Like, whether I'm going through this and they're all over the place, I'm like, yep, I know we need to work on, right? If we're going into that lunge, or we're doing a high knee and that knee's only coming up here, yep, I know we need to work on hip flexion. It's trash, trash, right? So I'm teaching them about these things and just being very playful about it, which kind of makes it fun, because we talked about, you know, preventative isn't sexy. So because it's not sexy, there's no focus on it. So it's just trying to make things fun and try to make it sexy, right? But after we do our high knees and our butt kick, we run into our skips, right? Working on coordination, whatever you do forward, you gotta go back, add some extra rotation, again, because we are working in 3 planes of motion.
And this is also helping increase your heart rate at this point. I like to say if at the end of the warm-up you're not sweating, you didn't do a good enough job, because that's what we're taking ourselves into activity. This should start, start slow, start with a little bit more of those like elastic stretches, but at this point we're starting to get our heart rate elevated to prep us for sports and our bodies ready.
You hear me.
That's right.
And I also use this as an indicator and assessment to let you know if you're getting in shape or not.
Yep.
Because as you go through the warm-up, it should get easier to do. Right, it should get easier to do. So after we do our skips and things of that nature, we go into the frontal plane movements, right? Working our shuffles, depending on what your sport is. You might be sliding more like basketball, taking out of boxing, so we're high on our toes when we shuffle, things of that nature. Working karaoke's, right? Turning, rotating, all of those things are important. And then after we do that, right? After we do that, I get extra, right? You grab the band, okay? Because now it's about waking up the muscle groups in the way that you're going to use them. So now that you're stretching them, okay, now that they're warm, I've got to add some pop back to it. So naturally, for a lot of the sports that we do, and especially in boxing, right, we have a lot of pronation in the upper body. And if you're not even doing sports, you're dealing with general pop, right? People sitting, computers, driving, who knows, right? But this is a natural posture for us, right? So we back, right, so strong in the front, so stretch the front. And strengthen the back, right? Sometimes we're holding the band for a certain amount of time, sometimes we're working it, right? Sometimes we're playing the tempos in between. Okay? Pull aparts, right? Range of motion, that goes left the belly a lot, right? Working on flexion and extension, right? You're going around the world, working them unilaterally, right? And you're feeling for discomfort, you get what I'm saying, or pain. And when you're going through this, you're like, yo, coach, I felt something. What should I do? Right? You're either going to bother them, you're just going to do some extra stuff to work around it, right? After I do the shoulder, same thing. Ankles. Get this around. Sometimes I like to work shoestrings versus the ankles. I get a little bit more tension when I go shoestrings versus ankles, right? But same thing, right? Adding some strength, right? Adding some activity back into my hips, working on those monster walks. We see them all the time, swinging, inside out, working backwards, but if you forward, you have to do backwards, right? You see it. And again, incorporating this sometimes might be difficult in terms of time, so the programming, they'll learn that time efficiency, and still work with everything that you're doing. Okay, so, and then normally after that, whatever we have for the workout is integrated to whatever we do in our warm-up. We pretty much know that. However you warm up is prepping you for whatever you do, whether it's workout or whether it's in-game sport competition.
And as athletes start to learn this protocol, if it's something that you're doing at the beginning of every single practice, if it's structure, if it's routine, it's something that they're going to be able to do pretty naturally without having to be told. What I do see is that the quality of that movement does start to disappear. We're not focusing as much, we're not locking into structure, to form, and being able to have athletes in a system in which they're able to do it efficiently without losing the quality of that movement is extremely important. I also find that, coaches, we don't have enough time, you're limited, especially in the high school setting. they will potentially get to a point where some of these exercises are so second nature that we can start talking about plans for practice as we're doing these things. Stay focused and locked in on your body, but also start using our brains and our ears, because that's important on the court, that's important on the field, to be able to move our bodies, to be able to engage our bodies in a way that's safe and patterned, while also listening to our coach and what their instructions are. You can start practicing that behavior early on in practice as well. Cool?
Yeah.
Awesome. Thanks so much. We're going to move on to the next one.
Next, we have Chairman Francis and Dr. Lane Spector on orthopedic screening.
Hi, everyone. All right, so my name is Chairman Francis. I'm Dr. PA. So my major goal in the clinic is to assess a patient. When a patient comes in with an injury, may that be an X-ray, may it be an MRI, assess the patient to where they are. And if I feel strongly that a patient needs physical therapy, conservative treatment, they go that route. If not, if it's surgical, we get them to that route as well. A lot of my patients go for conservative treatment first. I'm a huge believer of movement. All right? So if they fail conservative treatment and they need further imaging is when I see them, get an MRI, assess. Depending on what I'm seeing on this MRI, if it's surgical, I'll keep them, fix them surgically. If it's not, I will communicate with the PT and say, here's where we are. This is another surgical intervention. We need PT, and it may be 6 months of PT. All right? Well, we'll keep communicating on that.
And as a physical therapist, right, I'm getting someone from Sherman. There are going to be a couple things that we want to assess. I think it's also super helpful for coaches and athletic trainers to just kind of have a quick reference, right? If we're thinking about preseason, if we're thinking about postseason, right, ways to just assess movement so that we know where some of our athletes are. I think if you have the capacity, whether that means you have that at your hands as an athletic trainer, or right, if you're a physical therapist in the clinic, and there are going to be a couple other things that you can use. Typically, if we're thinking about the middle school or high school level, then manpower or resources just aren't there, especially considering, right, like how many people you were trying to triage at a certain time. So we're thinking preseason that we want to find ways to see how our athletes are moving, find a way to document that, and then also relay that to our coaches. Because again, right, we're thinking about what hurts versus what is injured, and then also here from a prevention standpoint, right, what do we need to be aware of? So we're looking at a large group of athletes, and we're also thinking about sport, we're thinking about age, we're thinking about position. And those are also just going to give us key indicators of what particular areas that we may be looking for, or what key areas we know traditionally yield more injuries during the season, and start to build programming around that. We can use that for our athletic trainers to keep track of, or we can use that, right, to send out to a PT, and we can just let them know, like, hey, this is what we saw preseason, they were injured, this is what they look like now, and then now from a continuum of care standpoint, we have a little bit more that we're working on. So today, right, with Sherman, we're just going to look at some pretty quick things here, because I think the stuff that's coming after is going to be super exciting for everybody. But we don't want to take a lot of time, and we're also looking at, right, big things like posture, right, range of motion, and then the third thing would be maybe something functional, right, some sort of functional task that can give you a little bit more information in terms of like how the body is being integrated. So Sherman's already where she needs to be, which is cool, because I would just assess posture here, right? And so as an athletic trainer, as a coach, right, we're looking at everything from the head to the bottom. So we're looking at, right, neck posture, we're looking at shoulder posture, right? Is one shoulder higher than the other? Is everything even across the board? And then also big things we're thinking about are 3 dimensions, right? So I would essentially, in the clinic or at the facility, I would look at Sherman from the front to see what that looks like. I would check Sherman from the side and then behind as well, because we want to see how everything plays together. So from the side, right, I can see what she looks like when she is stacked, right, where her ankles are, knees are, hips are, shoulders, and ears. Ideally, right, if I'm looking from the side, then I would want everything to be roughly a nice plumb line from the ear down to the ankle. But then we're also looking at lumbar curvature, right, what's happening at her low back, what's happening in her thoracic, which is right here in the middle, and then also cervical, right? Again, it doesn't necessarily have to take a ton of time, and really we're not trying to get into the minute details, especially for our athletic trainers and coaches, right? We just don't have the time. So really what you're trying to pinpoint are, what are key things that are standing out to you really quick, right? What are things that you can just pick out with your eye, document, keep track of for that athlete? If we are in the clinic, then we're probably going to be looking at things in a little bit more detail, because we just have the time, space, and capacity, and that gives us a little bit more information, especially if we're thinking about somebody that is coming in with an injury or coming in with complaints of pain or dysfunction, all right? So right after I look at, you know, where her hips are, right, looking at her iliac crest, looking at her trochanter, looking at where her knees are and looking at her feet, right? I think that gives me a really good picture of just what may be tight, what may be a little bit more loose, and then also maybe what are some of her natural, like, standing positions, right? So I don't want to cue anybody to say, hey, let's stand perfect in this position. I'm just going to say, hey, come in, let's just stand natural, stand comfortable, stand how you would if I wasn't observing. Because once you start like letting people know you're watching, then they're going to fix some things, right? So you want to see what they look like in their natural state. And right, you may notice some common tendencies. One shoulder's a little bit higher, maybe they rotate a little bit more, maybe they lean to one side. And that can again cue you to maybe where some of that dysfunction may be coming from, or just give you a general idea of where they are statically in their posture, all right? After I get a really good assessment, then we're gonna look at motion, right? We're gonna have her move. So easy thing, I would say, hey, Sherma, let's take your chin to your chest. All right, good, all right? We're just seeing what range of motion she has. We're documenting, right? Is that within range? Is that a little bit limited? Is that restricted? Is that stiff? Or even does that cause pain, right? We're gonna say, hey, Sherma, let's look up towards the ceiling, right? Good. Again, range of motion, what does that look like? Is she compensating any way you can move forward? If she looks up and she does a little bit of trunk extension, right? There's some disconnect there in terms of what's happening in the body. I'll say, Sherma, let's rotate to your right. Good, and let's rotate to your left. Nice, and let's look forward, right? So again, if I'm in the clinic, I'm probably going to be using a measuring tool just to document what those differences are. If we're an athletic trainer or a coach and we just want to see what our athletes look like pre or post-season, then we are just going to say, hey, is that even on both sides? Is that restricted on one side, or does that cause pain? All right, last thing, let's get your right ear to touch your right shoulder. Boom, and left ear to touch your left shoulder. Cool, all right, and let's look up. So a lot of times you're gonna get a lot of athletes that come in and they say, hey, I have some neck pain, I have some upper trap pain that doesn't really go away, right? Your cervical range of motion, your neck range of motion is gonna give us a little bit of information on where some of that may be coming from. If that is restricted on one side, if someone is trying to get their left ear to their left shoulder and they start hiking things up a little bit, we know that there is some compensations. We also maybe need to know if that is associated with pain or discomfort, right? And what that looks like. Again, there are gonna be certain things we're gonna handle there. There will be certain things that we may look and say, hey, this needs a referral, and we're gonna refer you out to a practitioner, whether that's their primary care, whether that's an ortho, or whether that is a physical therapist. All right, and then next, right, I would just like to see what a shoulder range of motion looks like. So sure, I just say reach up to the sky. Good. All right, and let's reach down, and let's do that one more time. Cool. Big things. Does this look even from side to side, right? If someone raises their head and they have a little bit more space between the ear and their arm, what does that mean? What does that look like? And we're documenting some of those things. Do they have full range of motion? Do they have full range of motion with pain? And are there significant differences between one side or the other? Again, we also want to be cautious of sport specific, right? If they're an overhead athlete, they may have more range of motion on one side than the other, and that may not necessarily be an issue to resolve, just something to note, because they are going to have a performance preference on one side, right? Also noting a dominant side versus a non-dominant side may yield a little bit different, right? Someone that is left-hand dominant may have more or less range of motion than the other. And then also, right, from a posterior side, right, we were just kind of looking and seeing what happens with our shoulder blades, right? Does that shoulder blade open? Does that shoulder blade close really well? And again, that is going to be primarily for our overhead throwers. So we're kind of looking at whole body here, but during the time that you have, you're probably going to condense that based off of the athletes that you're working with. So your baseball teams, that preseason screen may look a little bit different than your gymnasts or your football players, right? Or your basketball players because of position dominance, movement dominance, and certain preferences. All right, we also have her go through a full range of motion. So I just say, show her palms open, and let's open up. Good. And same thing here, right? Looking at range of motion, looking at any dysfunction. Does that cause any pain? How well are her shoulder blades moving? And are there any differences in compensation? So I'll go back really quick. So something that you often see, let me fix this question.
Yeah.
Right, and let's lift it above head. Yep, just move this way. Perfect. All right, and bring it on down. Right, she doesn't do a ton of it, but you will see a lot of athletes compensate. They'll get here, and then they'll start doing a whole bunch of trunk leaning. Right, they'll lean back, and they're like, "Oh man, that feels really great. I have full range of motion." And so things to document or to cue them to say, "Hey, at that moment, great, that looks good, but let's see what this looks like if you just keep your trunk still." Right, and so I don't want you to move your trunk. Right, excellent. So she still gets really adequate range of motion, relatively within normal, even on both sides. But you also may notice that once they keep their trunk still and they go above head, that is where they're like, hey, that actually does feel uncomfortable. I'm having a little bit of pain there. Or you may notice like significant range of motion differences. And so again, we're documenting that because then now we need to know that this is a compensator for this area, and then also trying to associate what muscles and what movements, right, are causing that dysfunction or could be a result of their lack of shoulder range of motion. Forward. So we've gone cervical, we've gone arms, and then so easily, let's go trunk. So I just have her reach forward. Good, perfect. And then you'll come up. All right, easy one here, right? I just want to see how the spine moves. Do we get a really good curvature? Are we looking finding any deviations in the spine, right? And then also what happens at our hip and our hamstrings, right? So a lot of times you'll get some people that cannot keep their legs straight. You'll also notice that because of their hamstring limitation, that limits how far forward they can get. And again, right, leaning forward, does that create any symptoms or any discomfort, right? So if we are in a preseason situation for a movement screen, then those are going to be the things that we document. The next, I'd say, Sherman hands or hips. And let's just extend back forward. Good, and come forward, right? Again, full range of motion, any discomfort, right? Anything that feels abnormal or any abnormal movement. So Sherman will let you lean back and maybe have a deviation towards me, right? And she comes up and she's like, oh, that feels great. But then I have her reduce that deviation and now she's having pain. And I know that there's probably something going on that we need to be aware of. So let's relax your hands by side. And I'll say, Sherman, let's just right hand down your leg. Good, and back up. And then left hand down your leg. Good, come up here. Again, full range of motion on both sides, any discomfort, any tightness, or any restriction, right? We're kind of just seeing how one side opens and one side closes, right? So let us know maybe if there's any like QL dysfunction or tightness, any light issues, right? She just kind of reaches. And so that's going to be important for overall trunk mobility. And the last one will be cross your arms. And then let's rotate towards me. Rotate. Okay, there we go. Good. And then rotate towards the other way. Excellent. And relax. All right, again, range of motion is going to be huge. Pain, dysfunction, or any limitations on that side. If we had overhead athletes, then sometimes we may do that in sitting, just to kind of see what that looks like when we remove the hips. So you can either put your hands on the hips, right? So I'll put my hands here, and then I'll say, Sherman, rotate to the right. Good, and rotate to the left. Good, and relax. All right, that kind of gives us a little bit more of what that true rotation looks like at the trunk without getting a little bit of that hip rotation as well. All right, so a lot of our, baseball players or softball players, overhead athletes, racket athletes, right? We kind of want to see what that rotation looks like at the trunk. To just see how much isolated movement they have there. Again, everything works in a system, so if there is some tightness or limitation in one area, then we have to see, is that a contributing factor to how they're moving or what pain that they're coming in. Again, we're also just noting what's limited, what's within normal range, and maybe what is painful. All right, so quick screen here. There are going to be some things that we can do on the table, such as hip flexion, hip internal rotation or external rotation, just to see what's happening at the hip. But then, right, once we have a good gross screen of how they move, then right, we would go into something more functional. I think for most people across the board, a squat is probably going to be one of the most functional things that we can see, and something that we can see relatively quickly, and something that they're going to do in the weight room and being in an athletic stance, right, some sort of squat-based movement. So I'd say, hey, Sherman, yep, feet right shoulder width apart, and I won't really cue her to do anything different. I'm just say, hey, give me a squat, right, and then you'll come up. Same thing like our range of motion. I would have her do this a couple times. I'm going to see what that looks like from the side, right? Good. I would see what that looks like from the front, and squat again. Good. And then, right, I'd come behind and just see what that squat looks like. And let's stand. All right, so big things that we can see, right? Functionally, we may have gotten our range of motion. Our isolated weight, we might get our range of motion to see what that looks like. And then now we have gravity involved, so we can see how all these pieces come together. Right? Is there a functional limitation in the ankle mobility? How do the knees translate over the toes? And then what happens at the hip, right? So those are going to be really key things that we're looking here. Also, from the front, we may see what's happening at the knees, right? We may see, are we getting what we call valgus? Those knees are coming in. There, so maybe some people just kind of have a wider squat there, all right? We're also trying to see what's happening at the feet, right? Is there a collapse at the ankle, or are her arches really rigid? And then also from either the anterior or posterior position, what is happening at her hips, right? Are we noticing any lateral sway from one side to the other? And that could be associated with things that we have found range of motion wise. If there's a limit in isolated range of motion, and then we're seeing them squat, maybe they squat closer to that side, or maybe they squat to the side where they have more range of motion. So again, you're just taking the pieces that you see really quick, and then maybe trying to identify a global picture of how this athlete moves. Also, if we're noticing any differences in the side, then right, we're going to be a little bit more cautious when we put them underweight or underload, right? If under body weight, they already have some deviations, and this is probably not an athlete that we're going to load really heavy. All right, so that also just lets us know maybe certain things that we want to put into their warm-up, right, to help strengthen these areas, mobilize these areas, and get them prepared for their lift or get them prepared for their sport. Or if we're like, hey, this patient is, or this athlete is coming with pain, and they're now presenting with these deviations in their functional movement, hey, let's go ahead and get you to a referral to an ortho, to your primary care, or to a physical therapist, right, to just get this further assessed, and then, right, we can now have a really good continuum care for this athlete. Another way to kind of challenge this, right, that squat looks really good, then I can say, hey, Sherman, let's work on our overhead squat, right? And so arms above head, and then let's get into that squat position. Good, and come up, right? And let's get one more shot. Good, excellent, right? And so again, we're gonna get a more full picture of what's happening in the body, right? As she goes into that squat, what happens at her trunk, what happens at her shoulders, right? Can she stay more vertically stacked, right? Where she is now loading at the ankle, hip, and knee really well and keeping a really good upright posture, or right, she deviated from side to side, and something that you may see, right, as someone goes into their squat, that they're probably just gonna hinge forward a little bit and arms come forward. So a little bit of limitation functionally, right, in that low back, maybe even that thoracic and upper extremity position. Again, the goal here for these movement screens are really to just identify what we see, right? Some athletes may not be coming in with any issues at this time, but we can say, hey, this is what I noticed preseason. So maybe over the next few weeks in our strength and conditioning program, or when I talk to the head coach, these are some things that we just may need to be on the lookout for with this athlete, right? So again, the more that we know ahead of time, the more that we can kind of be prepared for it, maybe the more that we can intervene as quickly as possible, right? Again, prevention is key. So I'm like, hey, this overhead athlete is limited in rotation, limited in shoulder flexion and external rotation in some of these areas. Then, hey, coach, like, can we put this pre-warm-up routine in for this athlete to put them in a better position for baseball practice or prior to baseball games, or for your quarterback, right? What are some things that we can do to warm them up really good so that as they're throwing over the course of the game, they can feel really good, and we can limit anything that's coming down the pike from an overuse standpoint, right? There are going to be some things that we cannot account for from contact, but there can be some things that we can account for from an overuse standpoint to kind of prepare them for what they're going to do over the course of the season, over the course of practice, and even especially for some of these high schools into the playoffs where they're just playing a crap ton of games. Okay? That's it.
Awesome.
All right. Thank you.
And we're at the end, y'all. So the last part today, we actually have Kwadwo Heath and Chris Torres on return to play for Ravens. And this is it. Y'all on that?
So me as a trainer, I'm big on movement, speed, and power. That's what I focus on. I mainly train football players, so I'm in the football circuit. Chris more of all sports, but like I said, I mainly focus on football. So when I get a player, I have a routine. Pretty much, I'm gonna go over some of the routines, and Chris can kind of explain to you how he see the range of motion is, or he can describe to you what we're doing. So I train both sides of the ball. I train wide receivers and I train DBs. So when I say I like to have a routine, because when I have groups, I have some kids or some older guys that's experienced and some not. So we got to start off on your basics. So I'm gonna give you a basic movement, and you will see why I started off in the way I started off like this, because it's transitions. It's transitions to the field, it's transition during practice, it's transition every day. So as far as receivers goes, we like to focus on acceleration and deceleration, right? So everything we want to do starting off at a receiver, we want to be explosive. So first thing we want to do is we want to stop false movement, right? False stepping is when at the snap of the ball, your leg come up like this, and then you take off. So we want to explode right off the ball. So when I say explode off the ball, they gotta look just like that, all right? So we don't want no false movement. We want to just move clean off the line, and we want to reach top speed, and we want to be able to decelerate. So I got this one drill where I line the ladders up, and what we do is we work on decelerate before we decelerate. So I have them in this motion right here, and then we just drop, right? We're gonna go all the way down the ladder, drop. All we doing is preparing for decelerating, right? So we got a 15, 20-yard route. Then we talking about some of the best athletes in the world. These guys get up to 20 plus miles per hour in 15 to 20 yards, right? Insane, all shapes and sizes of guys, right? So we running 15, we call this a square dig. So we gotta accelerate for 15 to 20 yards, and we gotta make a cut off of that without really losing time and speed. Because football is like this, right? So when I say we working on decelerate, so we come off and just say, this is the 20-yard right here, and I'm making a cut this way, right? Steps matter. Steps matter, speed matter, steps matter. So now my experienced guys, I can tell them, hey, we're running a 20-yard square cut. And it's just what it is, a square cut at 20 miles per hour. So what we don't want to do is we want to take a million steps at a time, right? We want to decelerate. We come here, 3 steps, and get out, all right? That is a square dig. When I watch football on Sundays and I'm watching these athletes, the best athletes in the world, when I see them do that exact drill in the game, and I see them teaching my athletes of all ages to be able to perform that, is big. Training is one of the biggest things going right now, right? So, like I said, we accelerate, decelerate, getting out without slowing down, like, how I want to put it. Like, not really slowing all the way down. So once we accelerate, decelerate, then we accelerate again. Because football is, you got seconds. You got seconds. DBs are smarter. So Chris can kind of elaborate a little bit more on the acceleration and deceleration on the offensive side, and then I want to talk about movement on the defensive side of the ball.
Yeah. So my job is to dissect this movement now, right? So I know what he's going to be demanded of in the sport. I know what he's trying to accomplish in the sport. So now I have to break that down, right? So for us, like our programs start with a blank sheet of paper. Yes, we have templates, we understand the science, we kind of have a program of what we're going to take people through, but the sport tells us something and the athlete tells us something. So what is it that we need to get, right? So if you line up again, let's just take your first step, right? Go step out, go ahead, accelerate, and stop right there. Good, good. So let's say he's in acceleration lean, like lean like you're actually running, right? So I'm looking at a couple of things now. I'm looking at ankle dorsiflexion, okay? So now I know I need to see, like, does he have the dorsiflexion to be able to get those toes pointed up, get his entire foot on the ground? That's really going to play a part when we start to decelerate, because if he can't get his whole foot on the ground and he's only cutting off of his toes, that's a half a foot isn't as strong as a whole foot, right? So now the other thing is, does his knee start to elevate, right? Is his knee buckling across where he sprints, right? So I'm going from the ground up. So I need to build knee stability there. And to build knee stability, I have to have glute strength and hip mobility. Because if he doesn't have the hip mobility and ankle mobility, now he's going to try to borrow mobility from the knee, and it's not really supposed to do that, okay? Another big thing that we're looking at is core strength. What does his posture look like? When he steps into the ground, are we transferring all that energy into the ground, which then transfers into us and forces us to accelerate? Or are we losing some of that because our posture is wrong, right? So now go ahead and go into your 3-step cut. Bang, bang, bang. Right, so again, so when he's going down there, go ahead to that first step, right? So these are the moments we look at, boom, all right. Can we forcefully plant that foot into the ground? Again, do we have that dorsiflexion? Do we have the knee stability, the hip mobility? Do I have the core strength to prevent my body from overflowing here, right? And break that down. do I have the hip mobility and thoracic mobility to get my body around into the turn, right? So when we do these drills, we talk about technique, tempo, load, and then game speed, right? For us to build trust, for us to build a relationship with our athletes, they have to know that what we're doing is going to get them better on the field, right? Or the court, or whatever it is that they do. So when we tie in our ankle mobility and our hip mobility, we're going to tie that in with core strength and knee stability. We're going to tie that in with an acceleration drill or a deceleration drill, and then we're going to tie that in with run an actual route. So now you can connect those two, right? Or you can connect all four of those things, and when you can see that they connect, now you're like, oh crap, the things that we were just working on is helping me run a better route. Now I want to do that stuff even more, because I can see how this is helping me. And now we have buy-in. And now I can ask you things like, oh, have you been doing your stretches? Have you been doing your ankle mobility exercises, right? And then that leads to more conversations like, hey, if you're doing these ankle mobility exercises and you can see the benefits of that, imagine if you slept 8 hours a night. Imagine if you drank water the way that you were supposed to drink water. Imagine if you ate vegetables, right? Like, so there are things that we can do that build trust and connect to the things that they care about, right? Later on today, I'm going to go with my family to the Filipino Food Festival in Norfolk because we love Filipino food, right? When I go to that Filipino Food Festival and I order my pork belly, they're going to give me pork belly. They're not going to give me salad and tell me, well, this is better for you, so you should eat this instead, right? Now, so much of what we do, because we're physical therapists, because we're professionals, we think that we know better, and maybe we do, and maybe we're trying to give them the things that we need, but we also have to give them the things that they want, and then connect it to the things that they need, so now they want what they need. You see what I'm saying? So that's how we break down a lot of these movements.
Yeah, and another thing that I see why I make it a program, because I have gotten scared so many times, have unexperienced players with experienced players, and I see the wrong movement, right? Just for instance, when we was talking about a 20-yard square cut at a high rate of speed, right? I've seen young men come out and scare me to death. They want to make that cut and their leg just like this. So immediately I'm scared because you didn't put all that force in the ground and you didn't absorb the ground doing your cut. So you just jamming everything right back up in you, and now I'm scared that you done tore some. Now I really gotta call Dr. Moore and say, hey man, hey, I gotta send you a player. Like, so I really believe, like with movements, like I was saying earlier, I'm very big on movements. Like, we have to constantly, in my drills, if you watch my drills, we always move, and it don't matter because it becomes second nature. So if you practicing your movements every day, then like I tell my athletes, in the game, you gonna do movements and your mind ain't even, you not even realize you're gonna do it. Your body is gonna do it because you didn't practice these movements over and over again. So I'm gonna go over, I know we're trying to get out of here. So I'm gonna show you on the defensive side of the ball, which is probably the second hardest position to play in football, next to the quarterback. That can be debatable. But what I like to start off in with my DBs, we're gonna start off in a crossover run, right? Head, eyes locked in. All we're gonna do is crossover run. Crossover run for about 20 yards. 20 yards. We're gonna do this side, then we're gonna switch sides. And I'm gonna show you what we're gonna do after that. So we're gonna heel, crossover run, because these movements that's gonna actually happen in the game. You wanna step in?
No, go ahead, finish.
These movements are gonna actually happen and transition in the game. So once we get that movement out of the way, we get used to that moving. So now we're gonna learn how to open up a little bit. So we heel, we cross over run, we flip, cross over run, and then at the end, what we're gonna do is we're gonna stay in what I call that power circle. So we wanna stay on the straight line, we wanna flip. Now we're using our hips, we come in here, and we wanna stay and drive right back down. So imagine somebody moving like that at a fast pace. So the crossover run, back down. So now what we're doing is allowing ourselves to be able to cover, move, and use our hip mobility, which a lot of my athletes have to come to Chris because that's what he specializes in. That's why I say I use my whole circle. I don't know everything. I know what to do on this field, but when it comes to mobility training and stuff like that, I send all my guys to him. So that's why it works together.
Yep. So I'll take that and I'll say, Key will say, I need him to work on his crossover run. Or I'll see a DB and say they need to work on crossover run. Cool. Well, I just see what the finished product is supposed to look like. It's supposed to look like that. So how do we get them to look like that? All right, what needs to be mobile, what needs to be stable, and then how do we tempo that in? Okay, so first thing that we're gonna do is we're just gonna do what we call the world's greatest stretch. So we're gonna get it into an inline lunge here, where both legs are pointed straight forward, okay? My back leg is fully extended, my hip is extended. I'm gonna get my hands out onto the floor, and then I'm gonna take this right hand, reach through this little gap here, and then up towards the ceiling. So this is already building some of that thoracic mobility, that hip mobility, that is gonna transfer into that position that they're going to be in when they get into that crossover run. It's gonna look a little bit like that. That's our mobility portion, right? Now, we gotta own that position, right? I can't expect them to get into that position moving fast if they can't get into it moving slow, right? So I'm gonna get them over here on the wall, and we're gonna talk to them about extending that left leg, full leg extension. Do I have that posture to actually get here and hold this for 30 seconds? Or is my posture caving in here? Do my hips start to sag? This is gonna help me identify what are the energy leaks in the system that I need to address before I get them to run, right? Now I can tempo in some of that run. I can stay here and do some of this tempo, get in, get out. Can you do this with good posture, with good technique, add a little bit of tempo, and then tie that into what he was just doing? So again, if I can show them why these stretches matter, why the stability work matters, right? Then I can create that buy-in that we're looking for that helps us build that relationship, and then now I can talk to them about some of the things that we talked about. Yeah.
And we go, I have every year, me and Chris, well, I didn't go this past year, but he went. But every year we go to Indianapolis to the NFL Combine. Most of the time, I have a few players there that train with me. Most of the time, me and Chris out there networking. Chris knows everybody when we go out there. He introduced me to some of everybody. But the thing I can say about that is what we've seen, what I have my athletes do is the same thing I see when I cut on the TV and I'm looking at the NFL Combine. We talk about movements. The exact same thing. But now what we're doing is we starting off like we spoke about earlier. Now they starting at a way younger age. They starting at, people reach out to me at the age, looking for training for the kids at the age of 6 years old. So that's why it's important for us as a community to stick together and have those resources for those parents. And that's all I pretty much got to say.
Yeah, man. Again, thanks to Dr. Oak for putting this together. I think this is an amazing event to be able to meet other people who are in the field, other people who are passionate about serving people. Today was about serving people. We did it through an injury prevention seminar, but we're all here to serve athletes and to serve people. So I'm blessed to be able to do that with great men like he, with our team over at Onyx, with Dr. Lance Bennett, with Sarah, with Aaron, hopefully another Aaron coming on board. And again, like the mission is greater than our company. So if we can help you, or if you can help us, like there's so much that we can do for this community, and this community deserves it. So let's do it.
Closing was locked. You guys begin, everybody. How y'all feel? Y'all felt like that y'all would y'all be leaving with a lot of knowledge today?
Absolutely.
I don't know, it was like a knowledge overload, but I felt like today I came here with like nothing, and I'm leaving out here like, damn, I'm gonna go home and do some stretching. I see Chris, I'm gonna be on the wall. I'll be trying that, so I'll be getting a lot of stuff, but we'll get some closure remarks from Dr. O, and we'll get up out of here, see how it's on.
Hey, look, I appreciate y'all staying late. I don't have a whole lot else, man. That's a wrap. I hope you took something from this. Please spread the word. It's an annual event. So we want this thing to ring, man, all over the community. So, future years, we'll see these joints filled up to capacity.
Yes.
All right. So I appreciate everybody who participated. Thanks for y'all's time. Yes, sir. Thank you, West Virginia. Thank you, Aaron, for setting things up. Thank you for the Rico Sportsplex for hosting us here. And we'll see y'all next time.
Thank y'all.